So there is sort of some conversation about what the future of, not only, prescribing for telehealth, but also telehealth and mental health in general. Certainly, I think mental health treatment is going to be is going to have a lot of systems and programs and laws that allow it to exist via telehealth. And I think the only barrier is going to be if you're needing to prescribe controlled substances like ADHD meds, or especially ADHD meds, since they're a controlled 2 substance. And so what would that look like? And there was already sort of movement on this before COVID happened. When the Ryan Height Law was active, any controlled substance required the prescriber to see the patient once a year in order for them to be able to prescribe it to them, and then they could do the rest of the appointments via telehealth. Now, Donald Trump, or at least his when he was president, I don't know if he reached out to directly or how that worked, but told the DEA that they needed to loosen the telehealth prescribing rules, including the Ryan Height Law. But he did that because of Suboxone, wanting to improve access to people who had heroin and opioid abuse or dependence, not necessarily Suboxone for pain management. So that's why he told the DEA. No, they didn't respond or do anything about it. And then eventually, when their deadline was about to approach, COVID happened and they suspended it. Now they're discussing what it would be like to bring it back. For the most part, I think the prioritization is that mental health meds or medications for mental health that are controlled substance 3 or 4 or 5 probably will be protected. There's a chance you'll have to still see people in person, but they'll probably be allowed via telehealth. And then non-psychiatric controlled substances and then controlled 2 substances like the stimulant medication likely will require some in person. At least that's what they've proposed so far. And what they've sort of allowed for is that if you have a referring provider, so like if your primary care doctor you see in person refers you for psychiatric services, and the psychiatric services person's across the state or across the country, then you can use that referring provider as that in-person visit. Now, a lot of the people I have right now who are across the state in Washington is the only place I'm licensed, but some of them are in the Seattle area who are getting treatment for ADHD. We'll probably try to do some sort of reverse referral system where they go to their primary care and they write a referral in hindsight or a current referral to represent the deadlines or dates the DEA does set if they do choose to put that in action, but they haven't made an announcement as far as the final rule. But they're not the only entity that's going to affect or influence prescribing. Like, for instance, right now in across the state, but in Washington, I'm seeing this, that a lot of pharmacies are already enforcing that these meds are only allowed to be prescribed by in-person visits. And the way they vet this is they look at our zip code and say, oh, you're across the state, you must not have been seeing them in person, and they won't fill the med. So a lot of the pharmacies are requiring an in-person. Some of them are requiring a last visit date was it in person. Also, insurance's policies is going to affect that. And also state laws. A lot of state laws also have in-person requirements for controlled substances, but not all of them. It seems like, reading it, again, I think that a lot of these entities or laws will protect mental health and telehealth, and allow people to get mental health services via telehealth, and not restrict that too much. The only restriction will likely be with prescribing ADHD medications, which would probably require an in-person visit from some prescribing practitioner, even if it's not your mental health provider, at least once a year.